This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about, are we doing unnecessary surgeries, specifically orthopedic surgeries? If you like this video, we put out new content weekly, so please like and subscribe. So the answer is yes, and to a certain extent. So there's some things that certainly need surgery, and nobody's going to argue with it. You break your femur or break your tibia, and you can't walk, and your leg's deformed or your wrist is deformed, you break your wrist. Obviously you need surgery, right? Mostly all the time. So that's not really what we're talking about. When you get into unnecessary surgeries in orthopedics, you kind of get into we call loose indications or soft indications, meaning you could treat it with not doing surgery, but you could also do surgeries. And that's generally where these things tend to happen. So there's certain things that definitely don't need surgery, and there's certain things that definitely do. The problem is when you kind of get into that middle area. And it depends on the surgeon. So some are more conservative, meaning that they have indications where they're only going to operate on you if they think you really need it. And others will tend to be like, well, we could do surgery, so we will do surgery. And that's not always a good thing. And I'll give you two stories that I know, that I've seen. One was a girl, it sounded like this is in training, that she dislocated her shoulder, which in someone that age, if they tear their anterior labrum, it's a good indication for surgery. And so at the time I was I was in training, I asked the attending, I'm like, are we going to get an MRI? And he said, no, we don't need one, which normally you get an MRI before you do surgery on that. So anyway, surgery gets set up, go into surgery, and there's no tear. There's nothing there. So I said, well, what are we going to do? He said, we'll just tighten her up. So now it's something that could have gotten better with physical therapy. Now this lady had surgery and has to undergo that whole rehabilitation process, including physical therapy, when she could have just done that in the first place. And that surgeon gets paid and everybody, but at the end of the day, it was unnecessary. And same doc, one time what happened is somebody had a mallet finger, which is when you kind of tear the tendon in the bone right here. Now there's a couple ways to fix that. One is just a split, which holds it straight for 6 weeks, and the other is putting a pin in there to hold it. Now sometimes people will get pins in there and they'll bury the pins. Let's say you are a surgeon and get a mallet finger, or for some reason you can't have your finger not in use for a while, then you're talking about burying the pin inside and then removing it. But this lady certainly didn't need that, and she could have been fine in a splint for 6 weeks. Instead, she ended up getting a buried pin and then, of course, another surgery to remove that pin. Again, you're going to get to the same outcome, but you might as well have done it non-operatively. At least that's what I would want to have happen, or depending on what your occupation is. So it's out there, and the problem is you don't really know, because some surgeons are really trigger happy and some really aren't. There are some that are really only going to do it if it's needed, and there's some that are going to do it if you walk in the door. So how do you tell? It's hard. You can't really. The only way, unless you have background knowledge, the best way to do it is if you think something's off or funny, to get a second opinion from another doc in a different group, and they'll give you an honest opinion about whether you need it or not. And there's nothing wrong with doing that, and I encourage my patients to do that if they have questions. So again, some docs don't do unnecessary surgeries, some do. And the best course of action for you is to get a second opinion if you're at all concerned. So I hope I was able to answer your questions about, are we doing unnecessary surgeries? If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.